This movie is an excerpt from a longer lesson, and you can find out more evidence-based information about childbirth physiology and practice in my blog, podcast, books, courses, mailing list and membership. Please see the links in the description and subscribe to this channel to be notified of new content. Now, interestingly, guidelines on antenatal care still don't recommend routine screening for large babies, only for identifying small babies. So the NICE guidelines actually say do not offer ultrasound scans after 28 weeks for uncomplicated singleton pregnancies. However, practice doesn't follow research evidence or clinical guidelines because practice is culturally based. And today, growth scans are common, and the findings of these scans can totally alter the woman's experience of pregnancy and birth. So, are ultrasound scans effective at identifying big babies? And the short answer is no. An ultrasound can only predict the size of the baby within 15% of their actual size. So if a baby is predicted to be 4 kilograms, the baby could be anything from 3.4 kilograms to 4.6 kilograms. And one study found that the risk of ultrasound assessment overestimating birth weight was greater than 50%, and this rate increased with the size of the baby. So for babies who were estimated to be 4.5 kilograms, only 28.9% of them were actually over 4.5 kilograms at birth. And in the study, 32.1% of women had a planned caesarean section due to being diagnosed with a big baby. However, 83.2% of these women had a baby weighing less than 4.5 kilograms, and only 29.8% had a baby over 4 kilograms. And these study findings are reflected in women's experiences of pregnancy. A US study found that nearly 1/3 of women were told they had a big baby in pregnancy, and only 1 in 5 of these women actually gave birth to a baby over 4 kilograms. Now, this study was carried out in 2015, and I think even more women are being told they have big babies today. Definitely not less women. So ultrasound is not a good way to estimate the size of a baby, yet it remains the most common method across maternity systems. And instead of questioning whether we actually need to know if a baby is big or not, for example, does it improve outcomes, the solution to ultrasound's ineffectiveness reflects our technocratic culture. And we are seeing research into using MRI scans to diagnose big babies. I kid you not. In this 2022 study, MRI scans at 36 weeks detected 80% of large babies compared to 59.1% in the ultrasound group, and had a false positive rate of only 5%. So it would appear that MRI might offer a more accurate estimation of whether a baby is big than an ultrasound will. Again, routine assessments to identify big babies are not recommended in clinical guidelines. And it would be great if we could decide whether there is any point in identifying a big baby in the first place before spending money and time on yet more technology.